Hey everybody, welcome to my channel. It is Dr. Leslie here. You may know me from over on TikTok, so welcome to my YouTube channel. I am a family medicine resident physician and I create videos here on YouTube, over on TikTok, posts on Instagram and Twitter as well, specifically about health education, giving you guys information about relevant topics. And of course, the most important thing that's been going on in our nation and across the world recently has been COVID-19, the novel coronavirus and infection that it is causing. And this is a really scary time, I think, for a lot of people. I have heard a lot of people making statements like, gosh, I don't know what's going to happen, and I'm nervous, I feel anxious, and people asking me, what do I do? How do I protect myself? And I think this is just a time with a lot of panic and a lot going on. And so I want to address that, and I want to talk about the path through and what we can do as a community to come together and to figure out what we can do individually and as a group to get us through this pandemic. Today, though, I really wanted to talk about and talk through a letter. So again, I'm a family doctor. I am still in my training as a resident, but I am a family physician, and we are primary care providers mostly, and we also work in the hospital taking care of adults, taking care of kids, and delivering babies. So we do a lot of different things. And recently, the head of the Minnesota Academy of Family Physicians, Dr. Renee Critchlow, who is an amazing, amazing physician and a very wise faculty physician that works in our clinic as well. She is just an amazing doc to work with. She put out a letter, and it's a letter to really the US, the world, about how we can make it through this process. We can make it through this pandemic working together and knowing that there's a path through this. And it was just such an impactful letter that I thought I wanted to read it out loud on YouTube. So I want to get to it and read this out loud to you folks. It's kind of long, so I don't know how long it'll take, and I'm going to be looking up because I have it here on my computer, so I'll just be reading it for you all. But it was a really, really helpful tool for me, I think, to help me keep perspective and know that we can get through this all together. So, dear fellow Minnesotans, and I'll add in world, US. As news sources continue to announce new cases of coronavirus disease 2019, COVID-19, as it's often referred to, in Minnesota, we know many of you have questions, but be assured there is a path through this. While this is a novel or new version of the coronavirus, we've been battling other varieties of coronavirus for many years. There will be serious illness in some, and we must all take precautions to decrease COVID-19 spread. For most healthy people, however, mild cases will have symptoms similar to the common cold. People begin noting symptoms 5 days after exposure and are sick for a week. Then symptoms start improving. We all know how to take care of mild cases. Stay home, drink lots of fluids, and curl up in bed for a few days. Things will generally get better with time and rest. If symptoms are worsening, you should recontact your healthcare provider. Otherwise, stay home until symptoms are fully cleared. Like any new infection, the first round in society is hardest. And then things start getting better. Testing is more readily available each day. Our public health system is hard at work. And Your doctor and nurses are here to support you. With some extra care, we can avoid getting sick. So here's how to stay healthy and limit the spread of COVID-19. Number 1, wash your hands. Use soap and water for 20 seconds. Use hand sanitizers that are at least 60% alcohol if soap and water is not available, and wipe down surfaces that might hold droplets containing the virus. 2, practice social distancing. This means keeping a 6-foot bubble between you and your neighbor to prevent spread. Coughing and sneezing into your elbow and avoiding touching public surfaces with your hands. Social distancing means finding creative ways to avoid physical contact with others. Shop at odd hours. Leave space between you and your neighbor at church, or just watch church service online. Avoid shaking hands and hugging. Use waves or jazz hands and big friendly smiles instead of physical touch. Avoid large gatherings in confined spaces. 3, take caution if you become sick. Whether you have a cold or the flu or suspect coronavirus, it's important to take care of yourself. Your first step should be to call your clinic to ask about next steps. Most healthy folks can treat this at home with acetaminophen or ibuprofen. Lots of rest and lots of fluids. If you're not seriously ill, then stay home. Stay warm and avoid infecting others. Healthcare is just a phone call away, and you'll be more comfortable at home in your pajamas than waiting in emergency rooms. Number 4, support those who are vulnerable. Who does this include? Anyone over the age of 60. Those who have lung problems. These are folks who use an inhaler or have smoked for many years. Those who have blood pressure issues, and those who have compromised immune systems, like those on chemo or who have had transplants. These folks may need extra help with the novel coronavirus, just as they do with flu or with a cold. The more severely ill need to be the focus of hospitals, physicians, and other healthcare resources. We all have many important folks in our lives who are vulnerable. Let us all work together so they have healthcare resources when needed. Remember, we Minnesotans stand together. We shovel each other out during each winter snowstorm. Instead of responding to COVID-19 with fear, we need to come together and fight this battle as a community. Not by literally coming together, social distancing, remember, but by supporting and caring for each other, by washing hands whenever touching public surfaces, by calling and checking in on family and friends, by inventing awesome no-touch secret handshakes with our friends, by dropping off medication, supplies, groceries at the doorsteps of our neighbors who need them, by preventing unnecessary exposures for those at risk, by avoiding nursing homes or leaving home when mildly ill, by encouraging others to contact their primary clinic by phone with any worries or concerns. As family medicine physicians, we know this community has the capacity to get through this together. We know how to take care of each other. What can you personally do to keep our community and state healthy? The choices each of us makes pave the path for the society we are and the society we want to become. Let us plan and prepare, not panic. Let us be there for each other. Let us choose care, compassion, and courage. We can do this, Minnesota, and we can do this, USA. And this says, sincerely, Renee Critchlow, MD, President of the Minnesota Academy of Family Physicians. Thank you all so much for listening. I really hope that after hearing me read this letter, you feel like you have a sense of purpose and an idea of what things you can do to help support your community. Everybody has a role to play in this, even if you feel like you don't. You are so important in making sure that we can keep our community safe and healthy during this pandemic, and you do have an important role to play. So I provided the link down below to the Minnesota Academy of Family Physicians website, as well as the WHO and CDC, where you can get more information. Please check those out. Also, please subscribe to my channel. If you like this content, please subscribe. I'll be doing another vlog video going over what the heck is going on in the healthcare system right now, what we're doing to prepare, and what that all looks like from my perspective as a family medicine resident doctor. And also, if anybody has any tips about what to do if you have a ring light and glasses, please let me know, because right now I look like I'm in a sci-fi movie. All right. Well, with that, I am going to head out, and please stay tuned for a lot more content to come, and I'll see you at my next video. Bye!